Hello. Hi. What's good? What's up? Got a doozy for you today. Psychotropic drug side effects. A real crowd pleaser. Um, let's do a quick overview of the side effects. And if I miss anything, how about you tell me? How about you tell me? Okay? If there's anything wrong with the audio, let me know as well. Okay? Cool. Cool. All right. So we got weight gain. This is cataracts. Sexual side effects, pretty broad. Hyperlipidation. I'm going to have to relook that one up. Myocarditis, diabetes, extrapyramidal symptoms, akathisia, tardive dyskinesia, acute dystonia, pseudo-Parkinson's, akathisia. This is serotonin syndrome, trouble concentrating, dizziness, sweating, nausea, flu-like symptoms, digestive system problems, low sex drive, sleep problems, chills, crying, muscle tension, confusion, hallucination, irritability, sleeplessness, suicidal ideation, delirium, excessive sweating, fever, cardiovascular collapse, seizures, that's dry mouth, nausea, nervousness, headaches. So if anybody wants to add anything here, please let me know. Okay? All right. So where should we start? Where should we begin? Let's start with nausea. That's a simple one. Nausea. Very common side effect of a lot of different kinds of drugs. Let's put it in D tier. That one's pretty manageable. Maybe we'll put it in C tier for now because we're trying to get a feel for how everything else is. Okay, now let's see. Flu-like symptoms. It's probably another C. I'm thinking this group over here seems a lot like some C level side effects. Let me think. I think this one is headache. As someone with chronic nausea, no, it's not. That's the thing. I mean, all of these can be worse, right? So this could be, if the flu-like symptoms were like bad enough to kill you, this could be an A or an S. But I don't know. I think as they are nausea, maybe a C tier. We'll see how everything else looks. Weight gain. Well, let's see. This is a big antipsychotic one, right? So weight gain in patients receiving standard doses of antipsychotics over a 10-week period. Yeah, 5 kilograms with clozapine, 4 kilograms with olanzapine, 3 kilograms with Sertindol, 2 kilograms with risperidone. It depends. Again, like that could be you could gain 200 pounds. You could gain 50 pounds. You could gain 10 pounds. You might even want to gain weight. So I don't know. That's a tough one. Let's see. A is psychosis. Thing is, psychosis. There aren't a lot of drugs where that is like the direct side effect. But now that you bring that up, actually, delirium. This is. I want to give it an A, maybe an S. Maybe an S. Let's see. Hold on. Loss of appetite is a common one for Adderall. Do I have loss of appetite on here? I think maybe not. Okay, I'm gonna make a quick little note to myself then. So yeah, loss of appetite. That's a good one. Loss of appetite. Weight gain can give you more mental disorders. Of course, look, everything can lead to everything else, right? But we're looking at these things in isolation. Okay, cataracts, kind of cut off here. But let's see here, cataracts. We'll put this in A, and I think we'll give delirium a cautious first S, but it's kind of like a low S. Diabetes. Yeah, we'll give diabetes an A. Again, Diabetes mellitus. I actually don't know what diabetes mellitus is. Is that different from regular diabetes, or is that just diabetes? No, that's the same thing as diabetes. Here, we'll just so you know what I'm looking at. Diabetes mellitus, a term for several conditions involving how your body turns food into energy. Okay. Yeah, and I think that's a side effect, right, of some of some antipsychotics. Like let's say antipsychotics, right? Yeah, it's actually, okay, it's not a direct side effect of antipsychotics, but it's the weight gain is a direct side effect, which then leads to the diabetes. Interesting. Okay, yeah, that's what I figured. It's hard to call that even a direct side effect. But yeah. All right. What does psychotropic mean? It's just an edgy word for psychiatric. All right. Suicidal ideation. Easy S. I think this one's probably the top, because you're taking your antidepressant, and then you kill yourself. It's what could be better? What could be better than that? Perfect. Delicious dramatic irony. Haha. Ha ha ha. Okay. Chills, again, D tier, whatever. Crying, D tier, whatever. Serotonin syndrome. This one's fun. So that's when you take like something for your depression, and then you're taking like another thing for your depression. So like, let's say you're taking an SSRI, one kind of SSRI, and then you take another kind of SSRI. Or like you could take, the thing I know this from is if you take like St. John's wort and you're also taking an SSRI, then that's just a blast, That's just a blast. I think your serotonin, it gets overloaded. Let's look at the actual side effects of serotonin syndrome. Occurs when you take medications that cause high levels of the chemical serotonin to accumulate in your body. Yeah, okay. Potentially life-threatening syndrome precipitated by the use of serotonergic drugs and overactivation. Okay, well, what does it do? What does it do? Yeah, it's life-threatening. That's why it's an A. I'm gonna give it like a very high A, or maybe like a low S even. Maybe a low S. I'll get a low S. Okay, what does it do? Seen with therapeutic medication use, blah, 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 blah. What does it do? Okay, gives you hyperthermia, agitation, akathisia. Serotonin can give you more mental illnesses. It's true. It's only with MAOIs. Yeah, right, okay. So yeah, it's mainly with MAOIs, I suppose. It's just this thing that I've heard, Also, Molly, or like, I don't know, a drug that impacts your serotonin while you're on an SSRI. I think there's some kind of relation there, I think. Let me look that up. Let's say I go to Psychonauts. Psycho Wiki. Okay, let's go to the only reputable source of information, okay? And let's look up serotonin syndrome. Okay, perfect. Yikes. Potentially life-threatening. Yeah. Okay. Headache, agitation, hypomania, confusion, anxiety, hallucinations, coma. Okay. Somatic twitching tremors, autonomous shivering, sweating, hyperthermia, hypertension, nausea, diarrhea. Okay. Okay, so then here we have the causes. We have all the nice little causes here. Let's see. Nail biting. Okay. Like I said, yeah, St. John's wort, but also some psychedelics can trigger it, MDMA. And yeah, you're right, mainly MAOIs. I'm not sure what that stands for. Monoamine oxidase inhibitors, also known as MAOIs. Okay. Thank you for the pesos, sir. Selective serotonin reuptake inhibitor. SSRIs, right? Okay. I think we can all agree that serotonin syndrome is an S. Is tardive dyskinesia on the list? Yeah, of course. So why don't we do tardive dyskinesia? And I'm just making notes of everything I've missed. If you take every psychotropic med, it cancels out all symptoms as you ascend into a new plane of existence. Yeah, I've heard that actually. Just kidding, kids. Just kidding. Headaches. Yeah, okay, we're gonna put headaches, nervousness. Oh, I have nausea here twice. Okay, we'll just double up on nausea. And dizziness. I mean, come on, you know? Come on. Oh yeah, I have dizziness twice as well. It's not. This isn't the most effective tier list. Okay. Hypotension. Let's see. Are we feeling more of a C or a D for hypotension? Let's remind ourselves what hypotension is. How about that? We'll really dig deep into hypotension. Okay, low blood pressure. How common is low blood pressure? What causes low blood pressure? Okay, dizziness, nausea, blurred vision. Okay, it seems to me like low blood pressure is basically just like the nausea stuff, but like slightly worse. It's either a B or like a high C. Maybe it's a first B. Can kill you? Okay, well, if it can kill you, okay, B for boring, am I right, fellas? Okay. Hallucinations. All right, you know me. We got to give this an S. All right, sexual side effects is pretty broad. We'll put it in B tier, I think. Myocarditis. Uncontrollable crying while you're trying to seem professional at work can be a C. No, definitely. I'll give this like a really high D because it's uncontrollable, but yeah, I mean that would be definitely a real interruption. Okay, dry mouth. What are we doing with dry mouth here? Okay, here, let me get your thoughts on this, all right? Dry mouth. Dry mouth and which one's this? Hold on. Okay. Dry mouth and I think this is hypertension. Yeah, I'm pretty sure that's hypertension. Let me just double check. Hypertension. Or is it hypotension? Cannot remember. Cannot remember what graphic I used for that one. I'm gonna confirm this right now. Hypertension. What did I even look up to find that graphic? Oh, okay. You know what? I found some more side effects that I'm going to add. Okay. Feeling emotionally numb. It's a great one. Hold on. Okay. I already have sexual problems. I already have weight gain. Reduced positive feeling. I think that one's specific enough to be a new thing. And feeling emotionally numb. And feeling dependent on the medication, or actually being dependent on the medication, I guess. Okay, cool. All right, yeah, so I think I'm going to make this either hypertension or I'm going to make this hypertension because we already have hypotension. I'm just going to put it on B. What do we think about dry mouth? Did we come to a conclusion about dry mouth? Dry mouth is D? Okay, D. No questions asked. Though, okay, here's the thing. It can be. It can kind of be terrible. I know there's like the Living Well with Schizophrenia channel. She talks about how she has dry mouth, and like she basically has to keep her mouth constantly like sprayed, or at least that was the case when she was on her specific medications. So like again, high D, but yeah, D. It's annoying, but you get used to it. Okay. Cool. Unstable heartbeat, arrhythmia. What about tardive dyskinesia? Okay. Tardive dyskinesia, I kind of want to save for last because it's so epic, guys. It's so epic. Irritability. C, D. No. Obviously that's a D. Sleeplessness / restlessness. Thinking like very high B or a low A. Just because like things are just way worse when you can't sleep, right? Like just way worse. Unstable heartbeat is B. Okay, let's get unstable heartbeat on here, huh? Unstable heartbeat side effect or irregular. Oh, heart arrhythmia. Is that a side effect? Okay, what is heart arrhythmia a side effect of? I think. Because if it's not a psychotropic side effect, we can't include it. Like heart arrhythmia. I'm sure some, psychiatric medication has that effect. I'm sure, it's just I don't know which. S for seizure. That could be fatal. The voices tell me S tier. Sleeplessness is high tier. Yeah, of course. Okay, that's why I gave it an A. Yo, a schizo stream, just what I needed. Okay, I don't need psychotropics to feel emotionally numb. Definitely schizoid personality moment. Turn off slow mode. Why do I have slow mode on? This is very anti-accelerationist of me. How do I do that? Turn off slow mode. I'm going to immediately regret it? Probably. All right, 1 second. I'm going to figure this out. Slow mode. Oh yeah, slow mode. All right. We'll do slow mode 5 seconds, huh? How about that? Accelerate. All right. Okay, 1 second here. Oh, okay. Actually, I have the original photos, everything I uploaded, so I can figure out what I'm talking about here. Okay, hyperlipidemia. So this one here. Hold on. Let me just zoom in. This is hyperlipidemia. Hyperlipidemia. A high concentration of lipid in the blood, an increased risk for cardiovascular disease due to the influence on atherosclerosis. Okay. So, I'm not sure about that one. Okay, you tell me what you think about that one, because I don't know. I'm going to go to myocarditis then. Myocarditis, let's see. Inflammation of heart muscle can cause mild disease without any symptoms that resolve itself, or it may cause chest pain, heart failure, or sudden death. Wow, it's a good thing. Never mind, I'm not going to say anything. We're gonna put that on an A. I might actually remove that though, because I don't know if it is a psychotropic side effect. It's on a list of psychotropic side effects, but what medications cause myocarditis? Medications or illegal drugs that might cause an allergic or toxic reaction. These include drugs used to treat cancer, antibiotics, some anti-seizure medications, and some illegal substances. So this doesn't strike me as a psychotropic side effect based off of what I'm seeing here. I'll do a little bit more reading just to make sure that that's not one of the things. Let's see, analgesics, COX, anesthesia, propofol. Like the anti-seizure medication isn't what I would call like stereotypically psychotropic. So minoxidil, that's interesting. Didn't know that was on there. That's interesting. Anti-infective, anti-cancer, yeah. Anti-metabolites, neurologic and psychiatric. Okay, stimulants. So stimulants can cause maybe. I mean, according to this. But like, and antidepressants. Okay, but I've never heard of that. Myocarditis. Antidepressant. Okay. So it is. Like, look at this. High doses of phenylalanine, which I guess is it's an MAOI. Okay, so it's the reason I probably haven't heard about it is that we don't use MAOIs very much anymore. But yeah, I think I can let it slide. I think I'm gonna let that one slide. Dreg, take your meds, we don't exist. Wake up, Dreg. Wake up, Junior Egg. Skinwalker, I was on Ritalin. Okay, Jordan Peterson was on akathisia. Let's talk about it, all right? Let's talk about akathisia. So, okay. Akathisia, a movement disorder characterized by a feeling of inner restlessness and inability to stay still. Often people feel like they want to crawl out of their own skin. It's true. That's what happened to Jordan Peterson. Jordan Peterson took the benzos and got akathisia. JP took those benzos and got akathisia. And I think it was sort of portrayed like he was like taking a lot of like benzos, like almost as though he had like an insatiable drug addiction. But the thing with akathisia is you can just like, your doctor can just prescribe you benzos and you can just take them, take them like a normal amount and you can still get akathisia. The other thing is akathisia isn't just a benzo thing. It can be an antipsychotic thing as well. So akathisia, it's like really bad. It's like kind of horrific. Where is Jordan Peterson's skeleton now that it's crawled out of its skin? Maybe they exist as two separate entities now. I don't know if I'm really doing how bad akathisia is justice. It's like, okay, here we're gonna read an article together, you and I. Let me see. Or maybe we can watch a video because we're all ADD here.
Akathisia.
Okay.
Inner restlessness, brought on as a side effect of medication. As many as 5% of patients taking some medications can suffer from symptoms so severe that it sometimes drives them to violence, self-harm, and suicide. Akathisia typically occurs when a medication is started, stopped, or changed in dosage or type. It is during these changes that it's critical for others to watch for symptoms of akathisia. There's a first responder, medical professional, family member, or friend. How can you identify symptoms of akathisia in a patient or loved one? Visible symptoms to watch out for include rocking back and forth, pacing, marching in place.
Right, yeah. So
inability to be still.
Akathisia, I think, literally means like lack of stillness. So you're constantly moving. I think your like adrenal glands are like constantly firing or something. You constantly feel like you're being chased. It's kind of like hell. And then a lot of people try to do the commit Sudoku just because it's quite terrible. But let's finish this.
Shifting weight, unusual or violent behavior. Less visible symptoms can include an increase in insomnia, anxiety, and agitation.
Yeah, it's really hard to sleep when you feel like you're being chased all the time.
Irritability, impulsivity, aggressiveness, hostility, and panic attacks. The following videos were recorded by people suffering from akathisia.
I sleep 1 hour in 24 hours for the last week.
I just want this to stop. This is what it looks like for me a lot of the time.
Also, like the whole restless leg syndrome. I think that's a synonym for akathisia, maybe, because it sounds like the same thing. I don't know for sure. Maybe it's like a less extreme version.
This hurts. It hurts. It hurts.
If the situation is urgent, call emergency personnel or go to the nearest emergency room for help. By recognizing the symptoms at the onset of akathisia.
Yeah, it's not good. Anyway, that's an S tier. That's an easy high S. I'm going to put that above suicidal ideation because it's suicidal ideation, but like worse. Because like that's just one aspect of the effects. So this is a fun live stream, isn't it? We're all having fun here. We're all having a good time. Deedly dee. Okay, cool. I feel like the chat is too slow. I'm gonna make the slow mode 3 seconds. Can you believe that I got limited monetization on this video? That's so wild to me. Akathisia is not real. Stop pretending. Yes, I'm sorry. We should have come to this conclusion earlier. And, okay, one of the meta frameworks that I'd like you to apply to all of this is that if anybody ever claims that the things that they're taking are causing any of these things, it's not. It's not real. None of this is real. It's all in your head. It's all in your head, and things that are in your head are not physical, actual, real. It's all just mind over matter. That's what I always say. Mind over matter. Okay. Trouble concentrating. Give that a D. Oh, what's this? Hypopatremia. That's interesting. Okay, let's see. Hyponatremia. All right, let's look that up. Hyponatremia. I've never heard of that. Never heard of this one. When the concentration of sodium in your blood is abnormally low. Okay, interesting. And then what's that caused by? Tell us, WebMD. What's it caused by? Medications, diuretics, some antidepressants. Okay, so we can justify this one. Oh, ecstasy and Molly as well. Drinking too much water. Okay. All right, and then what's it do? Nausea, fatigue, headache, cramps, irritability, weakness. Okay, so I'm thinking like a C tier. Hyponatremia. Unless it can kill you. Like a high C. Yeah, high C. High C. I guess it could kill you, right? You get kidney failure, heart failure, maybe a low B. Low B, just because it's physical, you know? It's like, well. The other thing is like, there's two kinds of weight gain where you gain like 200 pounds and then you get like diabetes. I guess if you just gain the weight and you don't get the diabetes, maybe it's not so bad. I'll move this up. Moving this up, moving these down. Flu-like symptoms, being constantly sick is definitely bad. Sexual side effects, definitely pretty bad. You know what? I think I'm going to add a new row. I'm going to call it B+. Or, B-. And that's for sexual side effects, this and this. Okay. Let's continue. Did we come to a conclusion about hyperlipidation? Did we? Hyperlipidemia. High concentration of lipid in the blood and increased risk for cardiovascular disease due to the influence of atherosclerosis. Hyperlipidemia. Your blood has too many lipids or fats. I think, okay, based off where I put hypotremia, I'm going to put it with hyperlipidemia. But let's see what everyone says. I feel like the chat is going too slowly. I can almost read some of the things that people are saying, and that's very unhelpful. Will the division between vaccinated and unvaccinated turn the political compass into a political cube? It's definitely a extra spectrum, which is tangential, I suppose, to the authoritarian libertarian spectrum. But I think it's unique enough to make it its own spectrum. You look at how the Black Lives Matter shaking hands with the traditional right wing anti-vax, you know. And then I think on the other end you have you also have some cross-compass unity in terms of getting the vaccine. So extrapyramidal symptoms. This one's pretty broad. I'm going to give it like a high A just because it's a high B just because it's broad. But like the specific ones, akathisia, kinesia, tardive dyskinesia, that's mainly an antipsychotic thing. Oh, you know what? Here, let's talk about this. Pseudo-Parkinsonisms. So basically, you can take an antipsychotic that gives you all of the symptoms of Parkinson's. So you get stooped posture, shuffling gait, rigidity. And this is because how the antipsychotics function on the dopamine. So like Parkinson's, dopamine is not just your reward chemical, fun fact. It's also, as far as I understand, related to movement. So a lot of movement disorders are caused by some issue with dopamine. Regular Parkinson's is, but when you block the dopamine with an antipsychotic, you also get pseudo-Parkinsonisms. You could get pseudo-Parkinsonisms. Let's see. Dreg, take my Concerta, delve deeper into psychosis. Wake up, don't take your meds. Yes, great. Good stuff. All great stuff. Do Bing... thank you, Mr. ANCAP. Just looking through. Dopamine reduction equals Parkinson's. Dopamine increase equals schizophrenia. Yeah, I think that makes sense to me. Is that right? Dopamine reduction, Parkinson's. Dopamine increases, psychosis and schizophrenia. And you take the antipsychotic, which blocks the dopamine, and then you get Parkinson's. It's weird though, because there's different receptors, I guess. You'd expect because from a very low resolution angle, looking at dopamine, you'd think to yourself Michael J. Fox, he has Parkinson's, so he must have low dopamine, so he must have low motivation. But that's not actually how it works. I think they're different receptors. I think it's a difference between D1, D2, D3 receptor. I don't know enough about that. Slow mode is centrist cringe. It's true. What am I? All right. I'll go to 2 seconds. How about that? We'll make a deal. 2-second deal. Should I change the thumbnail? Yeah, I'm gonna change the thumbnail. I'm gonna change it to tardive dyskinesia, because that's what we're gonna be talking about right now. Tardive dyskinesia. Perfect. Let's see. Slow mode is the status quo. Very true. Can I do 0.1 second? No. Come on. All right, tardive dyskinesia. Have we heard about tardive dyskinesia? What do we know about tardive dyskinesia? This is one of the really bad long-term side effects of antipsychotics. Now, look, let me be really clear here, okay? Medication is good. Oh, I get another thing. Akathisia felt like burning alive. It lasted 3 months. Doctors had no idea what's going on. Yes, okay. Let's go back to akathisia. Doctors, for some reason, won't even use the word akathisia, at least in Canada. So if you have akathisia, let's read what the studies have to say, huh? Akathisia 2002 study, overlooked. Because this is an old study, but I think it's still relevant, or at least it's relevant in what I can observe. Extrapyramidal movement disorder consisting of difficulty in staying still and a subjective sense of restlessness. Recognized side effect of antipsychotic and antiemetic drugs, but also caused by widely prescribed drugs and antidepressants. Again, none of this is to freak you out if you're thinking about doing it, right? I'm just be aware. The patient's behavior may be disturbed, treatment may be refused, or the patient may be suicidal, may be mistaken for a psychiatric problem. We report 3 cases seen in the psycho-oncology service which improved when the offending drug is discontinued. Right. That's the other thing. Akathisia, tardive dyskinesia, as far as I know, they go away if you just wean off the drug, and when you tell your doctor about that, they'll wean you off the drug. Okay. Yeah, so just something to be aware of. But yeah, it seems to me like the doctors could be a little bit more. Well, what's this? 1-phenylpropa 2-amine. Add brain degradation into the list. I think that's a little broad. Is there a specific word for that? Tardive dyskinesia is permanent, but akathisia goes away. You know what? Okay, let's go back to tardive dyskinesia. So, you take antipsychotics for too long. And you start getting tics, twitches, and you start sticking out your tongue and stuff. So here's some of the symptoms here actually: lip smacking, mouth puckering, excessive eye blinking. Actually, you know what? Let's just watch someone with tardive dyskinesia. Huh? Should we watch some Living Well with Schizophrenia, my favorite channel? No.
This video was sponsored and developed by Neurocrine Biosan.
Okay, hold
It's
on.
breakdown. I was hospitalized then, right before I graduated high school. The whole decade that was unproductive, and if I continued to do that, I would wake up one day, an old man, and not have felt like I accomplished anything. I was seeing a psychiatrist. Over the years, I was on a lot of antipsychotic medications until I tried one particular psychoactive medication that soon after I started taking it, I felt the best I did since I was a little boy. People look at me differently. I travel by public transportation, and I have kids turn around and stare at me because they're curious or they don't understand why this man's making faces. So I don't get upset about that, but it does upset me. When people see me grimacing, they come to the conclusion that there's something wrong with me. I also dealt with discrimination. Several times when I went with a friend into a restaurant, they hosted.
Definitely, like, he has it definitely pretty bad, but it can also get, like, terrible, like this here. Like this woman, you can kind of see, it looks very painful, like just being forced to stick your tongue out, make faces. Yeah, protrusion and rolling of the tongue, sucking and smacking movements of the lips, chewing motion, facial dyskinesia, involuntary movements of the body and extremities. So, yeah. Don't be afraid to try meds. My akathisia came from malpractice. They gave me a hemorrhoid shot instead of my next dose of antipsychotic. Yeah. Look up Odine's curse, the most cursed disorder. Okay. Ondine's curse. Fatal respiratory disorder occurring during sleep. Disorder is congenital, but in some cases can be developed later in life. Central hypoventilation syndrome. I guess like you just stop breathing during your sleep and die. Is that caused by neurotropics though? Neurodegenerative conditions like Parkinson's, multiple system, multiple sclerosis. Don't think this is caused by meds. Definitely seems pretty bad though. Definitely seems pretty bad. Okay. Did I put this in S tier already or what? Do I even have this? Okay, you know what? Pseudo Parkinson's. I'm gonna give that like high A. Akathisia. Oh yeah. I don't know why I have this twice. I should have something for like. Hold on. I'm gonna make a whoops tier. Hold on. Make this gray. Whoops. And put all my doubles in here. So let's see. There, akathisia there. Now we have nausea. Okay. Fever. That's just flu-like symptoms, so I'm going to put it here. Cardiovascular collapse. I'm going to put that with myocarditis over here. Seizures. Oh, S for seizures, am I right? Maybe like an A. Okay, digestive system issues. Let's see. Digestive system issues. Digestive system disorder. Okay. Pretty broad. Probably, yeah. High C. Oh, there's tardive dyskinesia. Okay. High S. Oh, medium S. Yeah. So I should check the chat. What is this channel? Great question. So many great questions coming in. Side effects may include alien hand syndrome. Is that a thing? phenomenon in which one is not under control of their mind, and their hand just starts doing its own thing. But what's the cause? Doesn't seem like a meds thing. Although it could be. All right, let's focus up here, okay? Sleep problems. I'm gonna put that in the whoops tier because I already have. Actually, do I have? Yeah, I have restlessness. No, not restlessness. Sleeplessness. Well, maybe just on a broader scale, I'd give it like a B. And then this is a whoops because that's sleeping as well. Tingling sensation, D. What's this? Shakes? Oh, anxiety. Okay. Yeah, like anxiety is a side effect of anxiety meds or something like that. Gonna give it a C. Acute dystonia. Actually, need a reminder about what dystonia is. Acute dystonia. Involuntary contractions of muscles and extremities. I think the fact that it's acute, though, I think it means that it gets cured when you get rid of the dystonia. So maybe like a B minus, high B minus. Muscle tension, D. Excessive sweating, D. Confusion, C. That's another sex drive problem. Actually, I like this image more than this image though. All right, we're down to 7 or so, and then we can add some more and then call it a day. Let's see, ranking eating disorders. Felt acute, might take psychotropics later. Alien hand is super cool, can be a side effect of seizures treatment. Yeah, just like your hand has a mind of its own. Really makes you think. It makes you think about the world and such. Eating grass helps me with my OCD. Great to hear. All right, enough chat reading. Gender tier list coming soon. Just got to figure out what to do for the chat on that one. Maybe slow mode 3 minutes. Prolongation QTC interval, an increase in the time between the start of the Q wave and the end of the T wave in the heart's electrical cycle. A prolonged QTC interval is a biomarker for ventricular tachyarrhythmatitis and a risk factor for sudden death. Okay. I don't really understand that. I don't understand that. I'm gonna put that in the whoops because that's kind of beyond my pay grade there. Okay, sweating, D. Shakes? Oh, tremors. Tremors, B minus. All right, now we're down to these last 4 here, okay? These are all different kinds of movement disorders, I think, caused by antipsychotics. I'm not too sure. Okay, we have dystonia. So this is like permanent dystonia, I guess. But I don't know if... okay, yeah, let's say you get permanent dystonia from an antipsychotic then, or from a psychotropic med, then that's probably like an A, high A. Chorea. Choreiform movements are brief, rapid, jerky, irregular, and unpredictable. They occur at rest or interrupt normal coordinated movement. Unlike tics, they seldom repeat themselves. Interesting. The face, head, lower arms, and hands are often involved. Okay. Again, I'm not too sure about what antipsychotic or antidepressant or whatever causes this, but it's definitely... I'm going to put it in whoops just because I'm not sure it gets caused by a psychotropic med. Tics, let's see. Okay. Causes include Tourette's and drugs such as phenothiazines and amphetamines. Okay, so tics can be a side effect of stimulants. Okay. So we're going to put that in B, near the extrapyramidal symptoms. And then last one is athetosis. Athetoid movements are slower, more twisting and writhing than coriform, and have larger amplitude. Most common involve the face and the distal extremities. Athetosis is often associated with spasticity. Causes include cerebral palsy. Dustin in the chat. Speedrun of mental illnesses. Look up Alien Hand. Yeah, I looked up Alien Hand. Slow mode is 1984. Slow mode is North Korea and China, which is based. I'm getting some mixed messages. Okay. I'll put this with the extrapyramidal. All right, now I think I need to add some more. How do I add more? Is it worth me trying to add more? Okay, let's see. Save. Psychotropics. Side effects. We'll make it psychiatric drug side effects. All right, now I'm going to share this in the chat so you can all make your own side effect tier list. And let's see. How do I, okay, let's say I create this tier list. And then, I can edit. All right, and then let's see. Okay, I get it. I get how to do this. I need loss of appetite. Let me know in the chat if we have any other side effects that we want here. Oh, anorexia is a symptom. Okay, that's fun. Long-term use of antipsychotics causes intellectual impairment. Okay. Intellectual impairment. As a side effect. I think that's too broad. Somnolescence, dizziness. Okay, cognitive impairment. Yeah, all right. I'll add that one in as well. Because that's definitely a symptom. All right, I'm adding like 5 or 6. I'm just gonna give the chat one last look in case anybody wants to add anything more. Oh, brain zaps. That's a good one. Aphantasia. Brain zaps. How did I miss brain zaps? That's a classic. There's ataxia as well, but I think we have that in terms of like, well, actually, you know, I'll just add imbalance as well. Ooh, nightmares. That's a good one. What's the word for brain zaps? Is there like a medical term? All right, I think that's pretty much everything. Is aphantasia a side effect? Because if it is, that'd be interesting. But I haven't heard about aphantasia as a side effect. My husband has schizoaffective disorder and aphantasia. If the drugs are stopping you from having uncontrollable mental sensations, then they could also be affecting controllable ones. I mean, yeah. Yeah. I don't think it's officially a side effect, but it just makes sense that it would be. Why do I feel like this is like pictures taken moments before disaster? All right. This is hearsay. Don't worry about it. I'm not gonna do aphantasia because it's not an official side effect, and we're all about officiality here. Okay, officiality. Thank you for the ironic donation, by the way, instructor. All right, instructor. What? Instructor Bixby. Okay. Ironic. Nothing ironic about it. Or is there? Do. All right. Boom, 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 ba-doom, boom. Okay. Okay, now I submit. Does this make a new one? Oh, okay, good. Just add them. All right. I got 7 more. 7 more, and then we'll call it a day. Reduced positive feeling. B, I'm making that out to be like anhedonia, which is pretty bad. Feeling emotionally numb, same area. Anhedonia. Feeling dependent on the medication, same area. Cognitive impairment, I think it's like an low S, just because, I mean, losing your intellect, kind of horrific. Anorexia as a symptom can kill you, you know? Low A, I mean, no, high A, definitely high A. Brain zaps. Brain zaps, I'm going to give like a B-. Definitely very startling when they happen, though. And then ataxia, which is just like imba. I couldn't get the whole thing, but it, like imbalance. Gonna give that a low, high, low B. Ataxia, actually, you know what? B-. Actually, ataxia, is ataxia even that bad, really? Either we get our needs met or we act up. The 4 needs exist on 2 spectrums: certainty versus novelty, and public significance versus intimacy. Thank you. Let's figure out the difficult one you put in whoops. Interesting. Is that an example of cognitive impairment? Mental retardation is a side effect of red pills. Okay. Disassociation. And I think we're good. I think we have everything we need here. We've covered the main ones, from good to bad to ugly. Yeah, I don't know. Is there anything we'd like to say before we go here? 100-dimensional mental illness spectrum. Anticholinergic toxicity. Remember them. Mnemonic. Red as a beet, dry as a bone, blind as a bat, mad as a hatter, hot as a hare, full as a flask. Anticholinergic toxicity. That is one, isn't it? I remember that as being a side effect. I'm not going to add it just because I don't want to go through the rigmarole, but let's look at it. Yeah, like you have too low choline in your brain, some bad stuff happens. It's true. But what causes it? Commonly seen in the emergency department, but is rarely fatal. Group of substances that block the action of neurotransmitters called acetylcholine at the synapses in the central and peripheral nervous system. And then, yeah, side effects. Side effects are dementia. That's a side effect? Jeez. Actually, yeah, I heard about that. So if you do Xanax, you're like 4 times more likely to get dementia. So, but keep popping them Xans, fellas. Damn, I'm actually really tempted to add this as well. Okay, you know what? That guy's face is just the symptom of dementia now. Dry mouth, body temperature, pupil dilation. Okay, maybe. Cycloplegia, blurred vision. Okay, I'll add that as well. Double vision. Increased heart rate. Tachycardia. Let's see, urinary retention, urinary incontinence while sleeping, glaucoma. Hold on, why would you get Here's the question, before I add any of these. Is an anticholinergic psychotropic? Okay, until the beginning of the 20th century, anticholinergic drugs were widely used to treat psychiatric disorders. I think I'm not going to add those just because we don't use them anymore. However, I'm pretty sure antipsychotics are also anticholinergic. Let me look that up. Antipsychotics, anticholinergic. Okay, so atypical antipsychotics have varying degrees of anticholinergic effects, but are generally associated with lower instances of EPS and tardive dyskinesia than conventional agents. So, can't you just take like a choline source in order to offset this if you're taking antipsychotics? Like, would that help? I don't know. Which antipsychotics have anticholinergic properties? Clozapine, olanzapine, quetiapine. All right, I guess because antipsychotics have anticholinergic properties, we can basically say all the anticholinergic side effects are also psychiatric side effects. So we'll add them. We will add them, okay? Okay, so dementia, retention, incontinence, glaucoma, and double vision. We'll add all those. I guess I should check the chat. What do we think? No, schizophrenia isn't going to be a side effect. My doctor is trying to put me on benzo. Should I take them? Do not ask me these things. Do not look to me for advice or answers. However, the answer is probably take like half. No, I'm just kidding. It's all a joke. It's a jest. However, in my experience, I have... No, it's all anecdotal. It's not even worth saying. Okay. I'm going to add these 5, and then we'll call it a day. Okay, upload a set of images. 1, 2, 3, 4, 5, 6, 7, 8, 9. Cool. All right. Okay. Dementia. Come on, that's an S tier. Like if you get dementia from your side effects, that's kind of adjacent to just dying, I think. Okay, paralysis of the eyes and eye pupil dilation. Okay, pupil dilation, or also known as mydriasis. I'm gonna give a C. Actually, B minus. Then the eye paralysis thing, I'm gonna give a high B. And then tarchydria, increased heart rate, I think probably low B. Double vision, D. Bladder retention, mid B minus. Incontinence, C. High C though. Medium C. Glaucoma. I don't know much about glaucoma. Any glaucomics in the chat? Group of eye condition that damaged the optic nerve. Okay, pretty bad. I'll probably put that with cataracts. Okay, now we're done. We have all of the side effects. I think the best way to see this video off is to just have like a side effects meme.
Call your doctor if you have unusual changes in mood, behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients taking Seroquel XR have an increased risk of death. Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction. Or if you have uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Seroquel XR and medicines like it, and in extreme cases can lead to coma or death.
Anyways, take your meds. Bye.